Ladies and gentlemen, welcome back. We Should Know is on there. I want to thank you for being with us today. We're coming to you on WCLN Radio, Star Communications, Channel 16. We appreciate you being with us. We're starting on somewhat of a somber note today. I want to remind you to remember all of those folks in Dallas, Texas, particularly the families of the now murdered law enforcement officers that have passed on. I also want to remind you that when you're in the community the coming week and the coming months, remind yourself to stop when you see somebody with a badge and thank them for their service. We have a lot of very dedicated professionals that each and every day, in fact over 9,000 in this country each and every day, do go out and do a tremendous job. We certainly appreciate that. Today we're talking about behavioral health and mental health, and we're talking to two folks that know something about that. We're talking with Amy Watson. Amy, you're a graduate of Barton College, East Carolina University. You're LPC licensed professional counselor, and we'll talk about what that means in a few minutes. You're also a mobile crisis supervisor for Easter Seals right here in Sampson and surrounding counties. We'll talk about that. You've been in the mental health field since 1993. Courtney, your name is out there. You're with East Point Behavioral Health, the MCO for this region. Also a Barton College graduate at East Carolina University. I'm seeing a lot of parallels there. Currently, you're a community relations specialist for East Point, covering Lenoir and Sampson County, and previously worked as a care coordinator for access to care, intake, and providing emergency and crisis services. And you have had experience in human services and mental health since 2000. A lot of knowledge between you guys. I want to open with crisis solution on a state level. The Crisis Solutions Initiative that was put into motion by Governor McCrory, also the Department of Health and Human Services, looked at the state. One of the commentary in the statewide Crisis Solutions Initiative, they wanted to look throughout the state and see what was being done right, which made sense to me at that time, and how we could replicate that. Let's start with what we're doing right, and I'll start with either one of you.
Okay. What we're doing right in regards to crisis services.
Yes.
Well, we do have mobile crisis services that is in this area, Duplin and Sampson County. That's a 24-hour 7-day-a-week, 365 days crisis line that individuals can call if they're facing a behavioral health crisis. And it's an access to services to get mental health assessments and to intervene and hopefully prevent hospitalization. So that is one thing that we are doing correctly in the state among many. Yeah.
Courtney, I know you do a lot of community education programs and they're publicized in the newspaper and various other places. How much does people know about behavioral health, and particularly mobile crisis, and are we doing what we need to do to get that information to people?
I think we're doing a better job getting the information out, but a lot of places I go, a lot of people do not know how to access mental health treatment. And so that's why we're on shows like this. We're constantly doing education series and things like that to help people understand how to enter the system and that there is no wrong door to enter mental health.
We have a tremendous, I think, burden and responsibility. A lot of agencies like local rural hospitals, especially like the one in Clinton, North Carolina, which is a small rural hospital, one of about 9, I understand, left in the state. When you look at those EDs and those emergency departments, Amy, as a supervisor for mobile crisis, what do you envision that you would like to see happen to not only reduce that load, but to help folks at that hospital better understand what to do with folks suffering from some kind of traumatic behavioral health issue?
Sure, yeah, because the hospitals are reporting their resources are drained. People don't know where to go, so they're going to the hospital doors. And then they're being admitted, staying 2 or 3 weeks. And if we can really get the word out about mobile crisis services, East Point and their access line, we can intervene, hopefully divert some of these behavioral health admissions, free up their resources, and then use our resources to really do a good evaluation, crisis plans, connect them with the appropriate service, and keep things kind of flowing and get these people the help that they need.
Both you guys, parallel for us, if you will, how the crisis intervention response to be a behavioral health issue, and this could be anything from a substance abuse issue to post-traumatic stress issue to numerous other issues I'm sure you could speak to. Parallel that for our audience with how we respond to physical health issues. We have tremendous paramedic teams in basically all the counties now. I know Sampson and surrounding counties have paramedics. We have, very expensive trucks that go on the road and go and look after people and bring them to the hospital and that kind of thing. Parallel that for us and help. I think that would help folks understand, because if it's a behavioral health issue, and if it's and you use the word crisis, which is part of what you supervise as that team, it truly is a crisis. I mean, it's like the next step could literally turn into a physical health issue,
Absolutely.
Either some kind of suicide issue or something of that nature. So tell us how that.
Yeah. Well, I think you kind of said it. In physical health, and sadly now in behavioral health, 911 is the ambulance that comes to your door to provide intervention in the physical health world. They also do that for mental health. So what we're proposing is that you call a 1-877 number to have us come out there and do an assessment and then connect them with the right resources, which in physical health is many times your primary care physician, where we would connect them with another behavioral health provider. I don't know if I'm answering your question.
Yeah, I think you're right on point.
But and to be able to see psychiatrists and get other services to help. But in physical health, you always want to avoid a medical crisis, and so that's what we're looking for. A crisis to us is suicidal ideations, planned homicidal, psychosis, substance abuse. I mean, it's a whole realm of diagnoses that, as you said, could result in very harmful and deadly results if there's not interventions. And we're trying
Courtney,
to get
I know when you're out in the community, you are doing a lot of programs with the hospital in the area. You're doing programs in different places, and a lot of them have specific baseline understanding of what different kinds of things are. Talk to us about some of those programs that you have offered, some that you're thinking about offering in the future.
Well, a couple things we've been doing in this area are mental health first aid, and that is kind of more on the preventative and reactive side. We've been working with local Department of Social Services, Health Department. We've also gotten all the probation officers trained in this area. And what our goal is to identify the symptoms of mental illness and substance abuse and get them linked to either natural resources as supports or professional supports as well. So that's something we've worked really diligently in this area. We also have crisis intervention teams, or CIT. We've had one class already in this area through Sampson Community College, and we've done work with Clinton PD and the Sheriff's Department as well, along with EMS, and we've got another class coming up in September, the last week in September, through the community college, and we're trying to get more just awareness out there to response.
Amy, how important is connectivity for you and your team to get into everything from businesses to government entities and let them know that you exist, that you will respond, that you will be there? How important is that?
Well, it's vital, because what's happening now is our law enforcement and hospitals, like I said earlier, their resources are drained. And so to connect and partner with other agencies to let them know about mobile crisis, we're a very underutilized resource that the community is just not aware of. So the more we can educate these businesses when there is a crisis, they know who to call, we will respond, and we know the system. A lot of the public does not understand how to maneuver through the mental health system now.
One of the things I think is important too is that in talking with folks, quite often there's a sense that if you can get to, quote, a medical doctor, that they can pretty much answer or deal with any of the questions or issues. And that's not necessarily the case. In fact, it's almost opposite of that, because they're trained specifically in one field that sometimes has a small piece of that to be behavioral health. Either one of you want to deal with
it? Well, I think what I would say to that is they're looking at it in a narrow way. Where mobile crisis, when we go out, we're looking at the whole person. What are their basic needs? What are their resources? And look at every area of their life so we can kind of identify the areas that may be causing this crisis, and then connect them with certain resources. So we have long-term results versus them going to the hospital resolving that one issue, they get back out into the community. They may not, go to another appointment, and then there's another crisis, and it's like a revolving door. So our efforts are really to look holistically at the person and help connect them through the other resources.
Courtney, I see part of this too as a financial issue in the sense of saving money. Your years of experience, do you see that there's a big piece of that, just financial, basically, if you can get somebody help before it gets to that breaking point?
Yes, I mean, we try to keep people as close as possible to their community, their supports, to the things that are working for them. So if we can treat them in their home, it's going to be a lot better than sending them away somewhere or keeping them in a hospital for weeks at a time where they're not really getting the treatment they need in like a local emergency room. So that's another good use of mobile crisis.
And as we're talking about this, you speak to this as well, because I think maybe a lot of folks that don't realize that the local behavioral health or mental health facilities have been dissolved for quite some time now. And that's a big question to ask you to speak to, because we're fixing to go to a break in just a second, but I want to stage that for when we come back from the break. Those local facilities are not there as it used to be, years ago, where you had a director of mental health in a county and that county looked after things. Now it's a regional capacity and about basically to move to a much larger capacity. But Amy, for you as a provider, that puts a lot more dependence on you and folks that work for you to do a much better job on being there and for folks to understand that are there. So I want to address that when we come back from break, and maybe we can discuss some of the particulars of that as well.
Okay.
Ladies and gentlemen, thank you for being with us today. If there's one show you want to call a friend, tell them to tune in. Today is that show. We're talking about behavioral health and crisis solutions. We'll be back in a moment.
You're out for an evening on the town. Finally a chance to relax and forget that you left your front door completely unlocked. Fortunately, you just installed a security system from Star Communications. With just your cell phone, you can check on your house, lock it down, light it up, and get back to relaxing.
You forgot to put Buster in his crate.
Unfortunately, we can't help with that. Security and automation from Star Communications. Call today to find out more.
Ladies and gentlemen, welcome back. We're talking today with two experts in the field of behavioral health and dealing with behavioral health issues. We're talking with Amy Watson to my right. Beside her is Courtney Boyette. Amy is the supervisor for mobile crisis response here in this area, and I use the word area because it's beyond Sampson County. Courtney is a community relations specialist for East Point Behavioral Health, MCO. Covers 12 counties in the eastern part of the state. A lot going on in that area. When we went to break, I wanted to, as I was kind of setting the stage for when we come back, kind of give people, I guess, a quick observation of where we were and where we are now, because at one time it was a local issue. You would call your local county and there was a director of mental health in that county, and they've had people that were county employees. That's gone away. So where we are now is a huge window, and it's become more specialized in my sense. So let's talk about that, and
Okay.
I'll just put that and let you bring us up to speed.
Well, in the past, people did know where to go for mental health and substance abuse and developmental disability services, which was the local mental health center. And then when mental health reform, privatization hit, I think it became very fragmented and people didn't know where to go because services left there and they went out to the providers. And I think that's what's happened in our system now is that people don't know where to go, but they do know 911 and they know the hospitals. And that's where they are going now, and it's creating a great burden in those two resources.
For questions on when we talk about mobile crisis again, and folks that are listening maybe will be thinking, well, what am I supposed to do? Can you give them a telephone number and walk us through how that works, Amy?
Yes.
And we'll use a scenario that Susan has a brother or John has a friend, whatever the case may be, and there's obviously some issues going on there, and it may have been going on for several weeks, and now they can't get him or her or whomever out of the house, and there's maybe some major issues there.
Yeah.
Oftentimes that could come from a phone call to you. They would not necessarily have to go to a phone call with 911 or to a law enforcement agency.
That's right.
Where does the stigma pick up, and which is easier for the folks listening today? To call you directly and say, look, I've got an issue here, can you help me with it? Do you think that folks would be more prone to doing that?
I think so. I think there definitely is a stigma tied to mental health and substance abuse. For mobile crisis, it's not as public, as going through the 911 or the hospital, through the hospital ER. To give the number, for mobile crisis, there's a couple ways you can make a referral. To Easter Seals directly, the number is 1-866-241-7245. If they were to call that number, as you said, if someone's at home, there's a mental health crisis, someone's contemplating suicide, they need help immediately, they don't have a plan and they haven't taken any action, they could call the 1-866 number and talk directly to a licensed clinician. We would do a screening over the telephone, and then we'd go ahead and dispatch out our counselors. Our counselors drive their personal vehicles. They are not marked vehicles. It's very discreet, so the community would not know, who's coming up to their home versus a law enforcement officer or EMS, that gets a lot of attention in the community. So in that way, I think it does help. It keeps it private and protects the person's information. Now, if we go in and do an assessment and the person may need hospitalization, we will help coordinate that. Ideally, it's voluntary. They go to the hospital on their own, but sometimes it's not voluntary. And that's when we may need to get law enforcement involved or EMS to help do transportation or something.
Courtney, it strikes me as you've talked to a lot of folks in the area and done many programs here, educational programs, does people really, I think, understand what Amy just said, is that there's a resource there of people that have specialized training and expertise in that area? This is not, just somebody they hired out of high school to drive a car.
That's
These
right.
people are very well trained and licensed by the state to do behavioral health training. Do we have enough folks that understand they do not have to call 911 or they do not have to call the police department or sheriff's department?
I think the need is to market mobile crisis as much as possible. Everywhere I go, I always ask the general question: do you know how to access mental health treatment or substance abuse treatment if you are in a crisis? And the majority of people don't know. And so that's why we're making efforts to get the information out there, because like she said, it's very private. People are worried sometimes. They don't want their neighbors to know what's going on. They don't want people up in their business, whatever the situation is. So it is a very discreet way to access treatment and get the help that you need.
Help us understand how we draw the line between an observer. I've had numerous law enforcement folks in, and we've talked about this idea of the phrase now nationally and the state level: if you see something, say something.
Sure.
So for the person out there that sees something, how do they determine whether I should call 911 or I should call mobile crisis number with Easter Seals? And it may be this a passing observer. It may be somebody that just observed somebody with a pretty aberrant behavior.
Yeah.
Maybe they know them from the community, but now they're some really strange things they're doing that is just not within what we consider the norms of society.
Sure.
Which way do we go first?
You want to take that?
Yeah.
It's kind of a tough question because it's almost like, there's not really, I guess, a definite answer.
Yeah.
But,
Yeah.
Folks, I'm sure are thinking, well, could I call Amy rather than calling the sheriff's department?
There's
because
no wrong number,
Yeah.
because we're going to screen.
Yeah.
And if we feel like law enforcement needs to be called out, we're going to call out law enforcement.
Mm-hmm.
If we feel like it needs to go to East Point Call Center, or if they call East Point or 911, I think we all partner enough together. So we would determine what would be the best, who would be the best responder, is what I was thinking as you're asking the question.
Mm-hmm.
Would you agree? Or?
I would, and a lot of times people just want to know what their options are, because if you've never been in this situation or you've never reached out for help, you may not know what the resources are. So I think by either calling Mobile Crisis directly or calling the call center with East Point, we can go through those options with you and what it is that you need to do next and give you that support and guidance to access the resources.
When we look at what you guys do, what area demographically, age-wise, and when we look at male, female, those kinds of things, Where's a lot of those numbers ramping up?
It's for us. It's typically the adult population. Mental health, substance abuse is growing. If you're asking where's our peak numbers come in the population, adult mental health and substance abuse, particularly in this area. But also, I think it's important to note schools can call us. You know, juvenile justice. There's other child resources that I don't know that we're as familiar with mobile crisis. That may be one reason why our numbers are more mental health driven. And honestly, some of the adult care homes here, group homes, call in this area quite frequently.
Well, you know, SROs at school resource officers. Do you interact with those folks a lot, Amy?
We do. We would like to see it more. We know things are going on in the school. They're kind of right in front line. If children are having a hard time that exceed what the school counselor could do, we want them to be just as aware to call mobile crisis. Yeah.
Courtney, I see a lot of what you do as far as engaging the public. It seems to me over the past few years that has become more of an aggressive component for care providers and also for managed care organizations like East Point to get folks connected with the system to understand it better. Are we getting there? Are we on the right road? Give us some ideas on, for schools, for example, connecting with the community in faith-based organizations. Are we there, and are we moving in that direction?
I feel like we're making progress slowly but surely, but there's always going to be new people coming into the system. We always have people that maybe lose insurance, they lose their job, maybe related to mental health or substance abuse, and they were getting maybe private treatment before, and now they're coming into our system. So we always have new clients and families that need to access our services. So that's why we continuously try to get out there and make sure folks know, how to get in.
Ladies, do you get a lot of, or do you get some comments or calls from folks that are dealing with children with adolescent behavioral issues that they're going through the different kinds of things that you go through in adolescent behavior? And to be quite frank with you, I'm not sure parents are always the most knowledgeable on that. They are parents, and they will continue to have the last call, I guess. But when you look at it, you tend to parent as you were parented, and sometimes you replicate the good and the bad. Yeah. So do you get calls on that as well?
Yeah, we're seeing a lot of adolescent issues in other counties as well. And compared to what was 20 years ago, the behaviors and issues are much more serious. Untreated mental illness, schizophrenia at age 16, 17, bipolar, gang activity, just a lot. And so parents are really at a loss of what to do. We had a call at 2 o'clock in the morning. A mom was basically being held hostage by her 17-year-old son. And she's reaching out for help on what to do. And so I think the issues are getting much more serious with the adolescent population. And we've got to get the word out so people know where to call, and to be preventative, to catch these kids when they're much younger, because when they are 15, 16, 17, it's very difficult to get them into the system.
The term nuclear family is something by definition that has changed radically over the past decade.
Sure. Absolutely.
Anybody that's involved with that child can potentially be a support to them, or it can also be a barrier to treatment. You mentioned gang activity. Yeah. That could be a huge influence on a child's life that we need to intervene with. So mental health treatment helps with things like that, substance abuse treatment. We see children very young at times just based on what's going on in their environment. If they're in a household where there's substances being used, we might see behaviors pretty early on. So it's really never too young for us to get involved.
I think it's oftentimes we forget that children are mini recorders. Whatever they see, oftentimes they will replicate whatever is said. They will repeat it back. I've got 2 young grandchildren, and one of my youngest ones will do that now. And I remind myself of that. We're going to take a break, and we'll be back in just a moment to continue this discussion. Ladies and gentlemen, thank you for being with us. We're kind of at the halfway point. Call a friend. Stay tuned. We're talking about behavioral health. We'll be back in one moment.
Whether it's video,
voice, internet, or cellular, Star Communications connects you to the things you love. It's what we do and have done for over 50 years. Star Communications, your local technology company.
Ladies and gentlemen, thank you for being with us. I want to thank all those folks at the radio station for mentioning us each and every week. The morning show with Nolan Z, Grandpa, and the L-Man. We also want to mention Wayne Weeks with the Gospel Hour each and every day on WCLN, Tommy the Fly in the afternoon, and of course Robert Stroud with the Boogie Shoes Radio Network on Saturday afternoon. Robert, we appreciate you mentioning us each and every week, and Nicole with Country Store that introduces this show each and every week. We appreciate, Nicole, what you're doing. We're talking today about behavioral health. Amy Watson and Courtney Boyette. Amy with Easter Seals, mobile crisis supervisor for the area. Courtney, public relations, community relations specialist for East Point MCO. I want to come back as we talk about behavioral health issues. One of the troubling areas for a lot of people is being able to understand this issue of substance abuse and addiction as a behavioral health issue versus a criminal justice issue. And quite frankly, it is a bit conflicting in what we're hearing, because we hear from the National Institute on Drug Abuse that this is a chronic relapsing brain disease, as diagnosed way back in 2012, I think. Scientifically proven, and it talks a lot about dopamine production, and I'm sure both of you could get into the very detailed particulars of that. But the other side is that if you have somebody that has an addictive issue, and if they find it necessary to rob a convenience store to get the money to continue to support their addiction, then we've got a serious problem going on here. And mobile crisis don't know about it yet. The only thing they know that somebody's been, incarcerated, and they're sitting in a jail cell, and all of a sudden, after about 18 months, or ever how long it takes to clear the brain, depending on what scientists you've talked to, then they become to realize, well, look, I don't know what I was thinking.
Yeah.
So help us. I'm going to just put that on the table and let you guys kind of help explain that to us. Is how do we actualize that? How do we understand that? And do we need to make significant changes on how we deal with those people?
Yeah. A question you had asked earlier are the parallels between the medical field and mental health and substance abuse. And I think substance abuse just really kind of highlights how these people are needing treatment, but they're also breaking the law. So the two worlds sort of can clash. And so I guess what I would say about this issue is to recognize that this is it's addiction, and although they may be making poor choices, it's something that needs treatment, professional help in treatment. And sometimes they don't want that treatment, and so that's another barrier or something that we deal with because that's part of the disease, that's part of the addiction that we're dealing with. It's a challenge, there's no doubt about it, and it's becoming an epidemic, if not already an epidemic. But I think personally, our communities have to recognize this is not something that we're going to be able to lock away, in a jail cell or in a prison, because really many times there's underlying mental health issues going on. Many times people start using drugs because they are trying to self-medicate underlying issues. And so I just think the compassion and the sensitivity about what we're dealing with is not something we can just law enforce away, the problem.
For our communities, our local communities throughout Eastern North Carolina, the counties that are listening or watching this show, the answer needs to be, I think, aggressively moved on, because it's an extremely expensive process. And you mentioned a while ago, a lot of folks that need help maybe don't have the insurance to do it, and number two, they're maybe not covered under a Medicaid waiver program that allows them to do it. So the only resource they have, guys, is that jail cell. And again, Amy, as you just pointed out, that's not a solution.
Right. Absolutely.
So what do you tell folks when we look at it from that perspective? And again, we have a number of legislators and congressmen and folks that occasionally tell me to watch this show. So some of those folks may be listening. So I think at some point in time we have to step back and say, is there something else we need to be doing from a legal regulatory range to be able to deal with that? I don't know. I want to put that on the table for discussion.
I was just going to say, nothing to me is sadder than watching somebody go in and out of jail for 10 or 15 years but never really get treatment. And they continue to just stay in a cycle. They go in for, various reasons, secondary. It could be mental health, substance abuse, or a combination of both. maybe stealing to support their habit, whatever. They go away, they get kind of cleaned out for a little bit because they're in a structured environment, but they really never get treatment or address the issues that are going on with them. And then they come out and go right back to the same environment, the same behaviors, and they just stay stuck in a cycle. And I just feel like we've got to do better for these families, for these individuals, for these children that are coming out of these situations, to get them more of a quality of life. And when folks are in jail, I feel like that's such an ideal opportunity to reach some people. We need more programs and things like that.
How do you explain, or how do you deal with the difference in enabling someone has an addictive behavior versus doing something that is positive to help them move beyond or understand that addictive behavior? Because the chemicals that we hear is dopamine production in the brain, produced primarily from the pleasure center of the brain. And for some people, depending on what that addictive substance is, and I jokingly talk about my 2 cups of coffee in the morning, if I don't get that caffeine that's in that coffee, I can tell you I get a little, headache or what have you, because wow, I forgot to have my coffee this morning. People that are on things like heroin, meth, other drugs, I've read 1,000 times that.
Sure. And this is a very complicated issue because you mentioned about enabling versus doing something positive. The family members are very much victims to people who are struggling with substance abuse. And I think it's a process, and it takes time for family members to realize the level of manipulation that may occur with people with drug problems. But when families start becoming aware and educated or see patterns, they can cross into enabling because they kind of know what's going on, but they don't have the heart to draw that line or have that hard, tough love that's needed with addicts, because the consequence of their drug use, it's significant. Homelessness, crimes, jails, prison, losing family members, death. I mean, it's the right all over the spectrum. And so enabling, I think it's a process to where that line starts getting crossed, if that makes sense. And this is, I wanted to mention, very complex because you also have doctors and law enforcement, and it's us, and doctors, our prescription pills are very much a problem in our communities. Absolutely. And so it's very layered and complex. And so when you're asking about laws being passed, the only thing I can speak to is substance abuse services and treatment. It's very complex in our state. Methadone clinics, it's not a very user-friendly system. They get there at 6:30 in the morning, got to wait in line maybe till 12 in the afternoon, every day, 5 days a week. These types of things I think we need to look at is how effective these services are, and how does someone work when they're in a methadone line to get their drugs. I mean, vocational education, all of these players come in when we're talking about rehabilitation for the substance abuse population.
Courtney, the governor was pretty aggressive on this, Governor McCrory, in his task force on substance abuse mental health, and Secretary Brazier. That task force did look at opioid use in the state, and the kind of challenging information that came out of 25 cities in the United States. Wilmington unfortunately scored #1 as it relates to opioids, heroin use in that area. And I'll probably get some calls from some people. So once I've said that, that's not to say that everybody in Wilmington, but just looking at raw data of the top 25 cities, and we could go around, and I think there was 4 North Carolina cities that was in that area. So I wonder what makes that. I mean, it is a lot of the task force information revealed folks that would end up on pain pills that were opiate-based pain pills, and then all of a sudden discover, well, I can't get the pain pill, but guess what? If I could buy it on the street, it's too expensive, so heroin is cheaper, so I buy an illegal substance called heroin that's highly addictive. I mean, in the same category with meth and other highly addictive substances. Where are we at with that, and how do we educate, as a person in the community trying to educate people, how do you educate people? Understand this is what you're dealing with. Because to your point, Amy, folks don't really want to talk about that, especially if you have it in your family. It's
That's
kind
right.
of, although it's obvious to everybody,
Yes,
you know.
Yes.
Well, I would say one thing, supply and demand is a huge thing. If you look at an area that has a lot of drug addiction, in order to get people in recovery, you have to have treatment providers and options that can meet the number of folks that you have addicted. And so I think that's a growing problem, getting the professionals, getting doctors, getting licensed counselors, people that can actually treat those addictions, to have enough of those folks in the community to meet that demand. So I think, like she mentioned, there's so many layers to the issue of getting people better. You know, sometimes there's waiting lists for programs, for methadone programs, things like that. Gas, you know, somebody has to drive, you know, like somebody on the outskirts of Wilmington or Sampson County to drive to maybe Goldsboro for a treatment program. They have to have transportation, gas money. There's so many different, you know, issues with it. They have to be able to work with their employer to get to the treatment program. So there's just different layers of the issue that we have to address.
Let's give some numbers out again as we kind of come to the close of this session. Let's give them your number again to reach
Okay.
you, Amy, as Mobile Crisis, so folks will have that.
Yep. The number is 1-866-241-7245.
Okay, and if they call East Point, Courtney, that's a triage number you're giving, and they could be triaged to
That's right.
Amy. Is that correct? So
Yes.
go ahead and give that number as well.
East Point, our call center is 24 hours a day, 365. It's 1-800-913-6109.
So the important piece of this as we go to break is that if folks have an inkling, for the word inkling meaning a small fragment of information that might be a problem, they could call either one of these numbers and go ahead and get some
right.
information going forward. We're going to take a quick break and we'll be back. Ladies and gentlemen, we're talking about behavioral health and the multi-leveled facets of behavioral health today with two experts. We encourage you to call a friend. Stay tuned. We'll be back in one moment.
Give me a home where no burglar can roam, where my kids and their pets safely play. With security by Star, I can check in from afar, hit the lights, lock the door, night or day.
Really? Yeah. I can see my cameras, switch the lights, lock the doors, set the alarm, all from my phone.
Their prices are right, my home's locked up tight, Star Security makes me feel great.
Ladies and gentlemen, welcome back. I want to start with a quick quote. The only thing necessary for the triumph of evil is for good men to do nothing. Edmund Burke. We're talking with Amy Watson, and we're talking with Courtney Boyette, both licensed trained specialists, supervisor, crisis, and I think the phraseology of mobile crisis is so important because folks look at it and go, mobile? That means I don't have to go anywhere? Well, that's exactly right. And Courtney, for you as an education specialist on behavioral health in the area, it's part of, I think, my role in trying, because this show, We Should Know, is based on education and information. So I think it's part of my role to try to open that window wide enough, as wide as I can possibly, for you to get the information out that you are there. Amy, there's so many people, and we've talked about this off air and in meetings before, that just simply don't know, number one, that Amy Watson is there, and number two, you know, mobile crisis is even available, because they'll say, well, who do we call?
Yeah.
So let's talk about how critical that is to get that information out, and also the money factor in that as well.
Yeah, I mean, marketing mobile crisis, it's critical, as we have shared, to be able to have people get appropriate assessments and connect with appropriate resources. Hospitals have their place and they serve appropriate people who need that, but many times people are hitting their doors that don't belong in the hospital. And so we can go out and do an appropriate assessment by a mental health professional to basically triage the person, stabilize the crisis, do a crisis plan. What is triggering? What can we do to prevent? Who do you call? And just really work through those issues with people. But if people don't know to call mobile crisis, then we're not going to resolve these many issues that we have. And we'll go anywhere. We don't have to just come to the home. We can go to a library, we can go to McDonald's, we can go anywhere except the hospital and jails. Those are the two areas that we cannot go because they have their own resources there. We serve all ages. Youngest we've had is 3, the oldest in their 80s. So this is, you know, from children, adolescents, adults, to geriatric population. Our staff are very well versed on the different populations that we deal with. For Easter seals, money is not an issue. It's not a barrier. East Point funds Easter seals with state dollars, and so that is not an issue. So if they're private insurance or have no insurance, they can still call us directly and we can come out. I must say though, some people want to leave their homes. They want to go somewhere, you know, and so that's why I want to point out we can go in other maybe neutral locations. Our main goal is to divert hospitalization and get the person in the right community provider.
Courtney, with that said, and that's a perfect lead into this, faith-based organizations is big in rural areas. I mean, and especially this county. God bless us, we've got steeples just about everywhere of the crossroads. Is that a reasonable place that somebody may want to meet, or when you talk to people, do you get, well, I don't, and I could see why somebody wouldn't want to go to the home, but is that a reasonable place to engage faith-based organizations, say, are you willing to open your doors to Mobile Crisis and others to meet here to discuss issues?
Well, I definitely think churches and faith-based organizations, those are safe environments where people feel supported. And you know, I encourage anybody that works either in a church or participates in a church environment, you know, make sure that you have the information for both East Point and Mobile Crisis, because a lot of times when people are not doing well, they will seek out their church family or people that have helped them in the past, and that could be their faith-based organization, and we can link them to the professionals both at East Point and at Mobile Crisis to help them with the crisis situation for a family or an individual.
I'm going to kind of zoom out now, and sometimes I zoom in, zoom out, so I'm going to zoom out. I'm forewarning you. Okay. When we look at a lot of things that's going on in our country now with a lot of protest about different things, and we all, if you've got unless you've been under a rock, you can see what's been happening in a few months. Do we need people, especially young people, now to stand up and say, look, you know, let's create a movement to do something, to make a difference, to be different, and not get involved in some of these deadly, disastrous things that we're involved in? Because, you know, I hear oftentimes of the bad situations, but I also am very knowledgeable of a lot of great, very well-meaning, very dedicated young people out there that are just unbelievable, responsible citizens. You know, Scouts and Eagle Scouts and others, and you don't necessarily have to be an Eagle Scout, but they're just great kids. What do you say to folks like that and to parents? You know, we need people to step up, because that's one of the beauties of the country we live in. We're able to do that. So if we can deploy people and talk about other matters, we could also say, listen, not getting addicted and being an addict the rest of your life also matters.
Yeah.
Commentary on either one of you on that.
Well, I was going to say there's definitely a place for folks in recovery. We have peer support specialists that work in the system now, and those are folks that are in recovery or they've had experience, whether it be through a family member themselves with mental illness or addiction. We want people that are successful to show folks that there's a different way of life out there. So we do support that, and we utilize peer supports. I know they're with veterans especially. That's a huge thing, having veterans maybe that have had a PTSD diagnosis but they're doing well, help them support other veterans. So there's definitely always room for professionals but also peers in our system.
One study, it's been probably a year or two ago, I read on returning military personnel from the Middle East, the highest number of suicides in the history of any war engagement, military personnel, and engaged in that same discussion was substance abuse and addictive behaviors. Where are we on that? Are you getting calls from military folks as well?
We do not get calls from military, not many at all. Recently we did have someone suffering from PTSD that the Veterans Office, I think in Wayne County, had called us, but that's been rare. So that's certainly a targeted population that we need to definitely reach out to.
Do you think they're working through their VAs, their Veterans Administration hospitals, those kinds of things? Because all the data is saying those numbers are just huge.
Yeah, yeah. So we don't have as much experience. I don't know if East Point is getting those calls, but I'm not getting a lot of those calls to us.
Now, I think there are, supports through the VA, but there's also times that folks can't get to the VA hospital for whatever reason, or to their outpatient clinic. And of course, we're that safety net to help them while they're in the communities. We do have individuals that are homeless, that are veterans. Sometimes we have to step in and provide support to them as well.
So when we look at where we are, and as we talk about this conversation, and we have talked off air about going forward, I want to engage the listening and viewing audience to continue to email us at weshouldknowedu@gmail.com about questions that they might want you guys to respond to going forward, because I suspect that in the future, I'm hoping you would come back and talk with us about issues. Talk with us about the progress you've made in the community, because obviously you're networking with the police departments here, you're networking with emergency responders to make a difference in people's lives. What are some of those things that you need from the public to help you as you move forward?
Well, for us, I think it's spreading the word. So if they're hearing about Mobile Crisis Now, I mean, we have thousands of these little cards. So if they see them, at social services, health department, wherever, grab a stack. And if they know people that are high risk for behavioral health issues, to distribute and just really spread the word from us. And this is a community effort. You were saying, what can young people do? We have to mobilize our communities and all come together and support one another. And I think just get involved, and if they see something, to call and get the information out there.
And I think, Courtney, that kind of covers over all color, economic, ethnicity lines, is this issue of addiction, because it's afflicting everyone. And it's a chronic disease that's destroying lives, as you pointed out, Amy, families as well.
And like I know with Mobile Crisis in East Point, we don't just stop at the county lines. Problems don't stop at the county lines. We try to follow folks wherever they go. Sometimes we have children that are placed in foster care in other homes. We still have to follow them regardless of where it is they go, and continue those services for them.
Well, I think the piece of the discussion today that comes forward to me is that both of you have the passion and the purpose for what you do. And I've talked to a number of people over my years of experience in not only law enforcement and education that are in that field, and it's almost, if that's there, I feel like something's going to happen, and I just don't think you're going to give up the battle on this. So as we kind of come and move toward the close of the show, I want to kind of give you an opportunity, just whatever we may have missed, Amy, or that you need to touch on, and give you about 30 seconds to cover it.
When you were just speaking, I was thinking we just have to get out of the box.
Yep.
I've been in this field a long time, been to many, many meetings, and you heard me say this probably first time you met me, where we're just not creating change. The system changes, but also we're seeing people getting sicker and not understanding where to go for help. And I think it's just time that we get the money into the system, and then we really think outside of the box and really make changes and get the outcomes that we want.
Good point. And oftentimes we just see people take a sticker and put on folks and say character flaw and push them aside, and we've got to be able to say, get that sticker off and deal with it.
That's right, absolutely.
Because that's a human life.
Yeah, that's right.
And I think also just spreading the awareness. The treatment just can't be with the mental health professionals. We need to engage more community agencies, because people with mental illness and addiction, they're accessing services everywhere. They're at DSS, they're at the health department, they're involved with law enforcement, EMS. So involving them in the problem solving and getting feedback from them, and doing a lot of cross training. And I think we're working with that with the Duplin Sampson Crisis Collaborative. We've started that over the past year. We're bringing everybody to the table to problem solve and to work with this population and families, and helping them get the supports that they need.
And that's a perfect initiative that meets that goal of the state crisis solutions group. They want to see local collaboratives come together, and you've done a great job with that. So, ladies, I want to thank you for what you do and what you will continue to do. And I look forward to having you back to talk about where this journey is maybe 3 or 4 months from now, because I want to kind of keep it engaged. And thank you, Courtney, for keeping these education programs going. Amy, thank you for your team and what you do in the community. And a lot of times folks don't see it, but
thank you.
we know it's there. Ladies and gentlemen, thank you for being with us today. We appreciate you being here again. I'll remind you to say something very positive to a police officer today, tomorrow, next week. We look forward to seeing you again next week on the radio, and may God bless.
Thank you for tuning in to this week's episode of We Should Know with host J.W. Simmons. If you have a question, comment, or suggestion regarding this or any episode, please send your emails to weshouldknowedu@gmail.com. And remember to tune in every Tuesday at 2:30 for another informative episode of We Should Know.